Inflammatory bowel disease is an immune dysregulation, and what that means is the immune system, which is there to help fight off and protect us from infection, has gotten a little confused, and instead of just dealing with infection, is now attacking parts of the body. And in inflammatory bowel disease, that part is the intestines and the GI tract. As a pediatric gastroenterologist, I see patients who have inflammatory bowel disease, giving patients abdominal pain, diarrhea, poor growth. My goal and my work centers around treating individuals with that and making them do better.
When I talk to families about the diagnosis of IBD, it's usually a shock to the families. So I tell them to begin with that we're going to partner with you guys through this diagnosis, and our goal is to get your child feeling better and your family functioning normally.
I think on the first visit, it's very important to talk to the family about what we know and actually what we do not know about what caused this to happen. And it's important for the family to know and the child to know that it's nothing that they have done wrong and something they could have or should have done.
The way IBD develops is a very complicated matter. In fact, our genes play a very important role in the development of IBD, but our genes are the similar or the same genes that our ancestors had, and IBD was a fairly rare phenomenon 100 years ago. And in terms of what in our environment has changed, there are two big triggers that we feel are implicated. One, antibiotics, which change the fecal microbiome, or those 100 trillion bacteria within our GI tract. And two, diet, which also changes the type of bacteria within our GI tract.
The two main types of IBD are Crohn's disease and ulcerative colitis. Both are characterized by an attack on the bowels by the immune system, causing harmful inflammation. In Crohn's disease, inflammation can occur anywhere from the mouth to the anus. Inflammation can result in stricturing or narrowing of the bowels, or produce abscesses and fistula, which are abnormal connections between the bowels and the skin, the bowels and bowels, or organs and bowels. Crohn's disease is usually described as being patchy, involving one part or many different parts of the bowels. Symptoms are usually dependent upon what part of the bowels are affected and how much inflammation is present. Some individuals may have recurrent oral ulcers that can make eating uncomfortable. While medications are effective in treating it, active Crohn's disease also carries a high likelihood of the need for surgery within 5 years of diagnosis. This surgery will not, unfortunately, cure the patient of his or her Crohn's. In ulcerative colitis, inflammation is present within the colon, also known as the large intestines. Ulcerative colitis is contiguous, meaning that it starts at the rectum and continues without interruption through the colon. Unlike Crohn's disease, if you have surgery to remove the colon to treat the ulcerative colitis, the disease itself is felt to be cured. But Crohn's and ulcerative colitis are not the only forms of IBD. Beyond those two, IBD represents many different types of bowel disease, and each individual is unique in his or her presentation, response to medication, and journey. And one person's experience with ulcerative colitis or Crohn's is not necessarily identical to another's. With that said, there are commonalities for individuals with IBD, and long-term observation has taught us a lot about the disease. Our ever-expanding technology gives us more tools to determine genetic and environmental influences on disease and how they express themselves in each of us. But no matter how much we know about epidemiology and science, IBD is highly personal and specific to each individual.